The global health community is currently monitoring a developing situation in the South Atlantic involving the MV Hondius, a polar expedition vessel that has become the site of a rare and deadly hantavirus outbreak. As of May 2026, international health agencies, including the World Health Organization and the Centers for Disease Control and Prevention, have confirmed a cluster of severe acute respiratory illness among the ship's 147 passengers and crew. The vessel, which departed from Ushuaia, Argentina on April 1st, has effectively been turned into a floating quarantine zone, with reports indicating that passengers have been largely confined to their cabins to prevent further transmission. This isolation follows the confirmation of multiple deaths linked to the Andes virus, a specific and particularly dangerous strain of hantavirus. Unlike most other hantaviruses found globally, the Andes strain is documented to have the capacity for limited human-to-human transmission, a factor that has significantly elevated the level of concern among public health officials. The voyage, which included stops in remote and ecologically sensitive areas such as mainland Antarctica, South Georgia Island, and Tristan da Cunha, was meant to be a routine expedition but shifted into a medical emergency in late April. The first signals of the outbreak emerged between April 6th and April 28th, when several individuals began presenting with symptoms that progressed rapidly from fever and muscle aches to severe respiratory distress and shock. The gravity of the situation was underscored on May 2nd, when the United Kingdom's International Health Regulations focal point notified the WHO of the cluster. By this time, 2 individuals had already died on board, and a third passenger, who had been medically evacuated to a facility in South Africa, was in critical condition before subsequently succumbing to the illness. The ship is currently being directed toward the Canary Islands, Spain, where a coordinated international response team is preparing to manage the disembarkation and repatriation of the passengers, who represent 23 different nationalities. For those on board, the sense of being held hostage by a microscopic pathogen is exacerbated by the strict protocols preventing them from leaving the vessel at previous ports of call, such as Cape Verde, due to the high risk of spreading the virus. Hantavirus is typically a zoonotic disease, meaning it jumps from animals to humans, specifically through contact with the waste products of infected rodents. However, the specific dynamics of the MV Hondius outbreak suggest a more complex transmission chain that is still being investigated by epidemiologists. The primary concern for health authorities is not just the immediate care of the sick, but the potential for the virus to be carried into new geographies by passengers who may still be in the long incubation period, which can last anywhere from 1 to 8 weeks. This timeframe creates a significant window of uncertainty, requiring rigorous monitoring of every individual who was on the ship. The logistics of managing the MV Hondius outbreak have triggered a massive multi-agency response involving the European Centre for Disease Prevention and Control, the CDC, and various national health departments. One of the most pressing challenges involves the tracing of 29 passengers who disembarked from the vessel in early May, before the full scale of the hantavirus threat was realized. These individuals, representing 12 different nationalities, left the ship at various stops including Praia, Cape Verde, and are now the subject of an international search. Health officials are working to locate these travelers to ensure they are placed under medical surveillance, as at least one passenger who returned to Switzerland has already tested positive for the virus after disembarking. For the American citizens remaining on the ship, the CDC has coordinated a specialized repatriation plan. 17 Americans are scheduled to be evacuated from the Canary Islands to a high-level biocontainment facility in Nebraska, a site chosen for its ability to handle highly infectious and lethal pathogens. This move is a precautionary measure designed to provide the best possible care while ensuring the virus does not enter the general U.S. population. Laboratory testing has been central to the response, with samples being analyzed in South Africa and Europe using reverse transcription polymerase chain reaction, or RT-PCR, and serological assays to identify viral RNA and antibodies. These tests confirm the presence of orthohantavirus andescens, the scientific name for the Andes virus. The genetic sequencing of the virus is being shared globally through platforms like Virological to help scientists understand if the strain has undergone any mutations that might affect its transmissibility. In the meantime, the ship's crew has been instructed to implement enhanced infection prevention and control measures. This includes the use of medical masks, frequent hand hygiene, and the avoidance of dry sweeping, a cleaning method that can kick up dust and facilitate the inhalation of viral particles. Oh, the clinical progression of the disease in the confirmed cases has been described as aggressive. Patients typically experience a prodromal phase of high fever and gastrointestinal symptoms, including nausea and vomiting, which can be easily mistaken for more common illnesses like influenza or seasickness. However, in the cases observed on the MV Hondius, this phase was rapidly followed by the leakage phase, where fluid fills the lungs, leading to acute respiratory distress syndrome and a dangerous drop in blood pressure. Because there is no specific antiviral treatment or vaccine currently approved for hantavirus pulmonary syndrome, medical teams are limited to providing supportive care, such as mechanical ventilation and fluid management. The disparity between those with mild symptoms and those who succumb to the virus remains a key area of study for the medical teams on the ground in Spain and South Africa. As the MV Hondius approaches its final destination for evacuation, the focus of public health reporting has shifted toward long-term surveillance and the prevention of future outbreaks in maritime and travel settings. Surveillance systems across the Americas and Europe have been placed on high alert, with the WHO advising a 45-day monitoring period for anyone potentially exposed. This period is critical because of the virus's variable incubation time. The core of hantavirus prevention remains centered on the management of rodent populations and the minimization of human contact with rodent excreta. In rural or wilderness areas, this involves sealing entry points in buildings, using traps, and cleaning infested areas with disinfectants like bleach, rather than sweeping or vacuuming, which can aerosolize the virus. On an expedition cruise ship, the source of the initial infection remains a subject of intense investigation. While the Andes virus is endemic to parts of Argentina and Chile, where the long-tailed pygmy rice rat serves as the natural reservoir, it is unclear how the pathogen entered the closed environment of the ship. Hypotheses include exposure during land excursions in South America or the presence of infected rodents in the ship's storage areas. Officials have been careful to state that the risk to the general public remains extremely low, as the virus does not typically survive long outside of a host and requires close, prolonged contact for human-to-human spread to occur. However, the limits of current knowledge are honest and clear. Scientists still do not fully understand why some hantavirus outbreaks result in much higher mortality rates than others, or the exact environmental triggers that lead to increased rodent-to-human spillover events. The MV Hondius incident serves as a stark reminder of the complexities of global travel and the speed at which a localized health event can become an international priority. For healthcare providers, now emphasizes the importance of taking a detailed travel history for any patient presenting with unexplained respiratory failure, particularly if they have recently visited South America or been on an expedition-style cruise. As the repatriation of passengers continues, the global health community will remain vigilant, documenting every development to better prepare for the next time a pathogen attempts to bridge the gap between the wild and the human world. For more updates on this and other public health developments, consider subscribing to our channel. The epidemiological response to the cluster of respiratory illnesses on the MV Hondius has necessitated a high-degree coordination between the World Health Organization, the European Center for Disease Prevention and Control, and the United States Centers for Disease Control and Prevention. Central to the investigation is the confirmation of Hantavirus andescens, or the Andes virus, a pathogen native to the southern regions of Argentina and Chile. While most hantaviruses are transmitted solely through the inhalation of aerosolized droppings from infected rodent reservoirs, the Andes strain is uniquely documented in medical literature for its potential for human-to-human transmission. This rare biological characteristic has forced international health authorities to treat the vessel not merely as a site of zoonotic exposure, but as a primary vector for a potential outbreak. Laboratory confirmation was initially delayed due to the remote position of the ship in the South Atlantic, requiring the transport of biological samples via maritime logistical chains to high-security facilities in South Africa. Scientists utilized reverse transcription polymerase chain reaction, or RT-PCR, to detect viral RNA in the blood and lung tissue of the deceased, alongside enzyme-linked immunosorbent assays to identify IgM and IgG antibodies in symptomatic survivors. These diagnostic results provided the empirical basis for the Spanish government's decision to designate the Canary Islands as the primary point of entry for the quarantined vessel, as the local healthcare infrastructure includes the specialized biocontainment capabilities necessary to manage grade 4 pathogens. The clinical progression observed in the confirmed cases has followed the classic, albeit devastating, trajectory of hantavirus pulmonary syndrome. Medical reports from the ship's infirmary describe an initial prodromal phase characterized by high fever, severe myalgia in the large muscle groups, and gastrointestinal distress, which can be misidentified as common influenza or norovirus. However, the subsequent leakage phase is marked by the rapid onset of non-cardiogenic pulmonary edema, where the virus attacks the endothelial cells lining the capillaries, causing fluid to flood the lungs. This leads to profound hypoxemia and cardiac failure. Because no specific antiviral therapy or vaccine exists for the Andes virus, clinical management is strictly supportive, involving the use of mechanical ventilation and carefully calibrated fluid replacement. On board the MV Hondius, the ship's medical team has been operating under extreme constraints, utilizing limited oxygen supplies and enforcing a strict cabin-only isolation protocol for all 147 individuals. This isolation has led to conflicting narratives. While some passengers have utilized social media to describe their situation as being held hostage, public health officials maintain that the restrictive measures are a legal and ethical necessity under the International Health Regulations of 2005. The standoff escalated when several scheduled ports of call, including Praia in Cape Verde, denied the vessel docking rights, citing a lack of specialized isolation wards. This logistical impasse ended only when the Spanish Ministry of Health, in consultation with the ECDC, agreed to a controlled disembarkation. Further complicating the core developments is the active search for 29 passengers who disembarked the vessel during its initial stops before the quarantine was enacted. These individuals, now scattered across 12 countries, are being tracked through the early warning and response system. Health agencies are particularly concerned about those who may have entered the long incubation period, which can extend up to 8 weeks, meaning the full scale of the exposure may not be known until mid-June. For the 17 American citizens on board, the CDC has activated a specialized repatriation protocol involving a chartered flight equipped with an aeromedical biological containment system to transport them directly to the University of Nebraska Medical Center. This facility, which previously managed high-consequence pathogens such as Ebola, is prepared to maintain the passengers under observation until they clear the double incubation window. As of the latest CITREP, lab results from the South African National Institute for Communicable Diseases are being cross-referenced with sequencing data from the Canary Islands to determine if the specific strain on the Hondius shows any increased affinity for human-to-human spread compared to previous outbreaks in the Patagonia region. As the MV Hondius approaches the final stages of its journey toward the Canary Islands, the focus of the international health community is shifting from acute crisis management to long-term surveillance and the reinforcement of global prevention protocols. For the public, the primary takeaway from this outbreak is the critical importance of understanding zoonotic transmission and the specific behaviors that can mitigate risk. Hantaviruses are not transmitted through casual social contact in the same manner as respiratory viruses like influenza, with the notable exception of the Andes strain. Therefore, official guidance continues to prioritize the management of rodent populations as the first line of defense. Public health agencies advise that in areas where hantavirus is endemic, including the rural regions of South America visited by the Hondius passengers, residents and travelers must avoid creating aerosols from rodent waste. Practical prevention includes the use of a 10% bleach solution to thoroughly wet down any areas where rodent activity is suspected before cleaning, rather than dry sweeping or vacuuming, which can launch viral particles into the air. For those in high-risk environments, the use of N95 respirators and gloves is strongly recommended. Clinicians globally have been issued updated bulletins to watch for the prodromal phase of the illness, which includes high fever, severe muscle aches, and fatigue, particularly in patients with a history of travel to the South Atlantic or Patagonia within the last 8 weeks. This extended window is necessary because the incubation period for hantavirus pulmonary syndrome is notoriously long and variable, ranging from 1 to 8 weeks. creating a significant challenge for port of entry screening and contact tracing. The surveillance effort remains one of the most complex in recent history, as health officials work to monitor not only the passengers currently on board, but also the 29 individuals who disembarked early in the voyage. The World Health Organization has established a 45-day monitoring period for all potentially exposed persons, a duration designed to cover the maximum possible incubation timeframe, plus a safety margin for the onset of symptoms. This surveillance is not merely a formality. It is a critical firewall intended to prevent the establishment of new transmission chains in the 12 countries where these travelers have returned. In Switzerland and the United States, medical authorities are employing daily health checks and symptom reporting systems for all repatriated individuals. However, the scientific community remains transparent about the limits of current knowledge. There is still significant uncertainty regarding the index case of the Hantavirus outbreak. It remains unknown whether the virus was introduced to the ship through a passenger who was infected on land, or if a rodent reservoir managed to infiltrate the vessel's food stores or cargo holds during its time in port. Furthermore, while genomic sequencing is ongoing, researchers have yet to determine if this specific iteration of the Andes virus has acquired mutations that increase its efficiency in human-to-human transmission, or if the close quarters of the ship simply created an environment where such transmission was more likely to occur. This lack of certainty underscores the necessity of the strict quarantine measures that have drawn international headlines. The ethical dimensions of the MV Hantavirus response present a difficult case study for future public health policy. The decision to effectively hold 147 people in a floating quarantine has been met with significant criticism from those on board, who described the experience as being held hostage by both the virus and the state. From a legal and public health perspective, however, officials argue that the restrictive measures were the only viable way to prevent a localized outbreak from becoming a global health emergency, particularly given the high mortality rate associated with the Andes strain. This tension between individual liberty and the collective safety of the global population is at the heart of the current standoff. As the 17 American passengers are prepared for transfer to the specialized biocontainment unit in Nebraska, the operation serves as a reminder of the massive resources required to manage high-consequence pathogens in a hyper-connected world. The international community's response highlights a shared responsibility, the need for transparent data sharing, the importance of maritime health standards, and the requirement for robust diagnostic infrastructure in even the most remote regions of the globe. As the situation on the MV Hantavirus eventually resolves, the data gathered from this event will be used to refine future quarantine protocols and enhance our understanding of how hantaviruses behave in closed environments. For now, the focus remains on the safe repatriation of the remaining passengers and the continued monitoring of those who have already returned home. For further updates on this developing story and other global health reports, consider subscribing to our channel.